Take a second and imagine being transported to a world outside of the reality that you're standing in. Imagine what's in front of you. Is it a beach, some new paradise, or somewhere where you can even have a conversation with an alien if that's what you so choose to do? What if I told you that these scenarios can all become real with modern technology? Virtual reality has become a new form of technology for people to essentially live in a figmented world, even just for a minute. The system uses many different senses of the body to create the illusion that you are actually present in that specific moment. Though it's mainly used for entertainment, what happens when virtual reality is brought into the professional world? There are endless possibilities as to how virtual reality can be incorporated into careers and such, but one of the areas of profession hit the hardest by this technology is healthcare. As someone preparing to enter the healthcare industry in the near future, I have done extensive research on the industry and how it's been influenced by this technology in order to understand how this development will affect the healthcare field. Today, I would like to inform you on the implementation of virtual reality in healthcare and how these changes affect both the improvement of medical staff and patients. First, let's analyze from the patient's point of view. Virtual reality has influenced patients by improving pain management. According to the National Library of Medicine, based on a study done in January of 2012, virtual reality acts as a non-pharmacological analgesia and exerts emotional affective processes on the body's pain modulation system. What this means is that the pain perception in the brain is presented these images and releases chemicals to ease the pain rather than using a medication to force these chemical releases. The use of multimodal, or many-sense, stimulation helps the patients to feel present in the moment rather than being in a hospital room or a doctor's office. This helps to relax the mind as well as ease the pain and stress that could be adding to the pain. Humans have a limited capacity for attention, so a pain stimulus must be attended to for the pain to stay at a high. And when the brain is distracted by all of their senses being used to focus on the stimulation, the pain stimulus and its response is less intense. The pain managed can be both chronic or acute. This method of treatment has been shown to improve pain in burn victims, cancer patients, after medical procedures, and endless other issues. Many studies have also shown that virtual reality can be used to manage psychiatric disorders causing mental strain. Now, let's talk on the flip side and discuss how virtual reality affects medical staff. First off, virtual reality is used in medical education and training. This method of teaching allows students to practice without an instructor. Without the need for an instructor, students can make informed decisions and analyze complex situations independently. This strengthens the learning process by having to work through challenges and situations instead of being fed information. With having to figure out the answers as well, replication and memorization can become much easier for the student, and it allows them to grasp the content quicker. Students can also work in many different scenarios and settings. Healthcare has no bounds, and employees can work in many different fields and specialties, and that creates a world of different patients and cases. According to MedVR Education, virtual reality allows students to practice in a hospital, on accident scenes, in trauma rooms, in specialized offices, ambulances, and many, many more. This gives the students the chance to adapt to the change and gives them a feel of working in critical situations. This technology doesn't just apply to beginners, though. Surgeons also use virtual reality in pre-surgical preparation. Surgeons can rehearse complex procedures repeatedly before operating on the actual patient. I know I would prefer to know that my surgeon has done the surgery 10 times over before operating on me. According to Stanford Medicine and their own virtual reality laboratory, they can take two-dimensional CT or MRI scans from actual patients and render them into high-fidelity interactive three-dimensional simulations using advanced computer systems and virtual reality. This allows the surgeons to study the patient's anatomy in depth and grasp the full situation in better detail before ever making the first cut. Virtual reality also uses haptics to give feedback that you can actually feel. Surgeons can use this haptics to mimic tissue interaction and the feeling of pressure and resistance while operating. More force or a different approach may be needed than what was originally thought in the procedure, but with these haptics, they can figure things out. The Private Healthcare System Information Network explains in an article that surgeons use haptic feedback to gain muscle memory and analyze how different structures will react to different instruments in different ways. So, for instance, a surgeon may use a non-ratcheted or non-ridged forceps while practicing, but they may realize that ratcheted forceps are needed to better hold tissue during the actual procedure. As I have presented, virtual reality is changing the way that healthcare functions. These changes are revolutionizing the future of healthcare and leading the industry to new solutions never thought of before. The main changes being brought are those in pain management, medical education and training, and surgical preparation. These innovations help the successes of healthcare greatly increase and lead to better outcomes for everyone involved.